Let's talk.
Let's talk.
Hello, Port Harcourt. Good afternoon and welcome to the sunny side on 92.3 Nigeria Info. TGIF. Thank God it's Friday, the Friday edition of the show. I'm excited because it's the weekend, and I think it's going to be a very long weekend for a lot of you who had the luxury to celebrate the public holidays away from work. But it gives me joy and it gives me pleasure, to work any day of the week, through the public holidays or not, as long as I'm sharing my days with you. Oh, that sounded nice. Welcome to the show once again. 22 minutes gone past 12. It's the 14th day in the month of May, and we got to kickstart our conversation with you. That's how much I care about you. But I'm quite curious to know how well you hear. Yep, you heard me right. How good is your hearing? Do you hear well? Or would you need to strain to hear when someone is speaking to you? Or would you need someone to shout or speak a little louder than they normally would when speaking to you? How well do you hear? I know maybe 2 or 3 people who I have to speak to loudly or repeat myself at least once or twice before they hear me. At least 2 people that readily come to mind right now. And so we kickstart our conversations today on the sunny side with your hearing. According to a report, about 700 million people in the world would have disabling hearing loss by the year 2050. That means it has already started happening. In the next 29 years approximately, 700 million people in the world would have hearing loss. How do you care for your hearing? Does that even come to mind as something you should do? When was the last time you paid attention to your ears? A vital part of your body. We'll start a conversation with that at 1 o'clock over time for the news update, as we always do. And right after the news update, we're going to have a conversation about suffering. And that, I believe, will make you think. I'm going to ask that question on that hour, so look out for that. And we got to wrap up the show today at 2 p.m. with the trend of skin lightening in Nigeria. But let's take a very quick break and welcome once again.
92.3 Nigeria Info takes the talk online. See pictures, news headlines, and be the first to comment and contribute. Follow us on Twitter at Nigeria Info PH. Like us on Facebook, www.facebook.com/Nigeria Info PH. Also watch and listen to us online. Visit www.nigeriainfo.fm.
Information liberates. Tune in to 92.3 Nigeria Info. Catch us online on Twitter and Instagram at Nigeria Info PH. On Facebook at Nigeria Info 92.3 PH. Drop a comment, like, and share posts from your #1 news, talk, and sports radio station, 92.3 Nigeria Info.
To thrive in a fast-changing world.
Tune in to 92.3 Nigeria Info for the best of news, talk, and sports 24/7.
Different ideologies.
Different perspectives.
Share your views on the sunny side.
92.3 Nigeria Info.
Let's talk.
Let's talk.
Welcome back to the show. Now, as we know, hearing is an essential part of how we communicate with others and become aware of sounds that happen in our immediate environment. Our hearing abilities start in our ears with channeling of sounds along, the hearing pathway, which are turned into electrical signs that travel to the brain. But hearing loss is a partial or total inability to hear. But when and how do you know if you have started to experience hearing loss? Now, like I said earlier, about 700 million people estimated, according to a report, would have culprits. Yeah, so am I sometimes. More people are coming down to have a greater risk of acquiring a hearing loss earlier in life. So we're going to start a conversation with certain questions. I have joining me via telephone an E.N.T surgeon, Dr. Victor Ikenga. Good afternoon, doctor. Thank you for making time to join me on the show. Can you hear me?
Hello?
Yes, good afternoon.
Yeah, I can barely hear you from this end.
Is it better now?
Hello?
Can you hear me now?
Please, can you be a bit loud?
Okay, can you hear me now?
I can hear you, but you're not loud.
Okay, so let's just start with this question. What does it mean to have a hearing loss?
Okay, when you have hearing loss, it means that you have at least 30 decibel loss in the back ear. What it means is that what the normal person needs to follow, you don't have what the normal person needs to follow up conversation. It means that for you to follow me, to talk with me, I have to raise my voice a bit more. So it's in grades. There are some people that have, at least they have the mild form. There are some that are moderate. There are some that are profound. There are some that can't hear at all. So what the people that, somebody that has hearing loss can actually be categorized based on the level that we can measure, and that level will also tally with the level with which we can follow conversation.
Right. So what are some of the common symptoms of hearing loss? How can a person identify?
I can't hear you well.
Okay, so I'm asking, what are the common symptoms of hearing loss? What are some of the symptoms of hearing loss? How can a person tell?
Hey, please. Madam, please, can you be loud a bit?
Okay, so here's what I'm going to do. I'm going to hang up the call and call you again. All right? And I hope it's going to be better then. We'll just take a very quick break so I can call him back, and then we'll continue the conversation. Don't go away.
Different ideologies
and different perspectives.
Share your views on the sunny side.
92.3 Nigeria Info.
Let's talk.
Let's talk. Are you up to date with ideas for sustainable development? 92.3 Nigeria Info serves you opportunities
to ask great questions,
contribute solutions,
and transform society for the better.
I'm listening. Are you?
92.3 Nigeria Info takes the talk online. See pictures, news headlines, and be the first to comment and contribute. Follow us on Twitter at Nigeria Info PH. Like us on Facebook, www.facebook.com/Nigeria Info PH. Also watch and listen to us online. Visit www.nigeriainfo.fm.
Did you know?
Did you know? Did you know? Did you know?
Did you know?
Did you know?
Did you know?
Did you know?
Did you know?
Did you know? Bole and fish. Bole and fish is a Nigerian delicacy made of roasted plantain and fish. The meal is a special street food or roadside delicacy which the capital of Rivers State, Port Harcourt, has been identified with. As a matter of fact, Port Harcourt is now known as the capital of Bole and fish, as visitors who have heard of the delicacy always request for it as a treat. The ingredients that make up bole and fish, plantain and fish, are readily available in Rivers State, which is a tropical rainforest region. Plantain is a staple food in many tropical regions and easily grows in swampy areas. It could be prepared ripe or unripe and is either fried, boiled, smoked, or roasted. The many rivers in River State make fish available for the bole and fish combination. Bole and fish is usually served with a hot and spicy palm oil sauce or stew, with secret ingredients only known to the one who prepares the sauce. Remember, palm oil was once the mainstay of the Nigerian economy, so it is no surprise that it's a constant for the bole and fish sauce. There is a variant of bole and fish in some parts of Nigeria. In the western parts, it is known as bole, and it is served with ground nuts. However, a well-prepared bole and fish from Port Harcourt would leave you with a finger-licking experience and longing for more.
Different ideologies,
Different perspectives.
share your views on the sunny side.
92.3 Nigeria Info.
Let's talk.
Let's talk.
All right, welcome back to the show. I've got my guests right back with me on the line, Dr. Victor Ikenga. I'm sure you can hear me better now.
Yes, I can hear you better.
All right, so let's continue the conversation. I was asking, my next question was, what are the common symptoms of hearing loss? How can a person tell that their hearing is being tampered with?
Okay. Oh, well, that's the symptoms will depend on the stage. In the very young, as in children, the first thing complaint is the parents will give is that the child is not practicing. Of course, you see that somebody that usually when somebody that can convert even in a quiet environment, you have to shout.
Yeah.
You'll be talking to the person and the person is not hearing voice whenever you're talking. And some other people will not hear at all. Sometimes it could be sudden, you just wake up suddenly and there's no hearing. Or you just, you were exposed to a certain, say, very loud noise, and thereafter you cannot hear again. So the symptoms will vary with the age. For the very young, mainly the first thing that will occur is that they are not able to speak. When you check, you also find out there is a hearing problem. Then in the older children and adults, the manifestation will be like you have to speak louder or you have to shout, but the person will be able to hear what they're saying.
Now, again, with those symptoms, is it in every situation where you have to shout or strain to hear that is directly connected to hearing loss?
That is it. Well, of course, there are some malingerers. There are people that will be training not to hear for some reasons. Like you see that mainly say accused. You take somebody to the court, and when you're talking, you tend not to hear. Also, people that want to get some economic benefit from people, they stand on the road and they tell you they're deaf and dumb. Meanwhile, actually, they might be hearing. So there are conditions where some people they don't have hearing loss, but they will pretend not to hear it. So there are conditions like that.
Now, when does a person need a hearing aid? At what point will the person decide, or rather need, a hearing aid?
Well, not every person that has hearing problems needs a hearing aid. Some people, some hearing problems are not amenable to hearing aid. Some might be surgical. Some might be hearing aid. Some, besides hearing aid, there are other treatments that can be given to somebody that has hearing problems.
Okay.
Some of them could just be minor repair of the hearing mechanism. Some of them could be cochlear implant. Then, of course, the hearing aid that you mentioned. So, it's not all hearing problems that will be amenable to hearing aid.
What are really the causes of hearing loss? What really causes it, especially in adults?
In adults?
Yes.
Okay. The commonest cause of hearing problems. Okay, the causes of hearing problems in adults will include as in exposure to very loud noise for a very long time.
Okay.
People that are exposed most times to very loud sound, music or whatever industrial noise are most likely going to have hearing problems. Also, some drugs that people will take can also knock off your hearing. And then there are some diseases that one of the complications could also be hearing problem. And then age. The older you grow, is the more likely it is that your hearing will diminish. So that's for the older. Those are the commonest causes: drugs, loud noise, age itself. Those are the commonest causes of hearing problems in adults. However, in children, because there are also causes, causes in children will include things that happen before birth, things that happen during birth, and things that happen thereafter. The things that happen during pregnancy include some of the drugs that we take can actually make our children not to hear. Some infections that the mother are exposed to during pregnancy can actually affect the child. Then there are some congenital problems affecting the genes, genetic problems that can also cause hearing problems. Then things that happen during labor. People that have very prolonged labor, the chance of the children having hearing problems is high. The people that have obstructed labor also. Then immediately after birth, children that have a very high bilirubin, that people that have neonatal jaundice in the first 1 month,
right,
have higher chance of having a hearing problem. Also, people that have convulsion in the first 1 month of life also have chance of having hearing problems. People that have early meningitis will also have hearing problems. Then, of course, the drugs that we mentioned is also there, can affect hearing all ages. So those are the common causes of hearing in our environment.
Right. As a follow-up to that, how can we tell what drugs can affect or cause a hearing loss? You mentioned drugs a pregnant woman takes, during pregnancy, and also drugs that adults take for whatever ailment. How can we tell what drugs could affect our hearing?
Okay, there are drugs that have been known to cause drugs. We call those drugs ototoxic drugs. That photo is here. Toxic, that they are toxic to the ear. There are drugs that are already marked as that. Then there are other drugs that the everyday drugs that we take that could cause. So the ones that are already known, anti-cancer drugs, some drugs that are used to treat hypertension, some drugs used to treat HIV. Then of course, even the drugs, the everyday drugs people take, in some individuals vary. The way my body handles the drug might be different from the way your body handles the drug. So you can take the normal drug and then you will still have a hearing problem. Then anti-TB drugs, so of course, but TB is becoming so common in my environment. Anti-TB drugs, a lot of them are known for hearing problems.
All right, so that clearly explains that. So what are some of the treatment options available for hearing loss, the different types of hearing loss?
Okay, usually hearing loss will be conductive. Conductive, I mean, is, of course, in the ear, the ear is divided into three parts. You have the outer part of the ear, you have the middle part of the ear, and then you have the inner ear. Now, any of these parts would contribute to hearing loss. When you have a problem in the outer and the middle ear, that will give you the conductive type of hearing loss. But when you have a problem in the inner ear, what you have is the sensorineural type of hearing. Now, these very different types will have different treatments. Most of what you do for the conductive hearing, the hearing loss, will be mainly some intervention. Sometimes even simple wax, very hard wax, will cause some form of hearing loss.
Really?
The treatment will just be doing. Yes. Yes. I've seen so many patients like that. The treatment will just be remove all the wax. Then, of course, the eardrum will just be open and that will be the cause of the hearing problem. The treatment will be to repair it. Then there are small bones in the middle ear that we call the ossicles. They could be dislocated. So the treatment to that is just to repair the ossicles. Then, but the most things in the inner ear, Jonathan, those are the ones we start talking about hearing aid. Then the worst form of it is that you might need the cochlear implant. The cochlea is like the sense organ for hearing.
Right.
So in some people, the cochlea will be completely dead. So the treatment is to put a new one, an electronic one, and that will just be the treatment.
So how can a person take better care of their ears to prevent hearing loss?
Okay. Well, of course, the preventions will arise from the things we've mentioned as the causes. For women that are pregnant, of course, you must register for antenatal care very early so that they will monitor you. These infections in the mothers that can cause hearing loss will be prevented. For those drugs, they will not take drugs anyhow. They will just give you drugs that is known not to affect the hearing.
Right.
Then, of course, during the labor period, the labor will be supervised. At any point when they feel like the labor is about to be obstructed, intervention is done and the baby is delivered quick. Of course, treatment will follow after. Those will prevent hearing in children. Then, of course, in adults, loud noise is becoming so common. In those days, when we live in villages, they were more quieter environment. But now, industrial noise, party noise, noise of megaphone, noise of generators, they're becoming so common. And so you have that hearing loss in the nearest future will become a very common problem because of this very loud noise. So part of the way to prevent hearing loss is to reduce the noise in our environment. Let's try, I mean, we should have, as in a cluster where people are using that, we should have a central generator so that everybody hears when the noise will not be so loud in the environment. But when everybody has one room appliance, everybody has their own generator, of course, you know the noise will be very loud. Then in our practice, we should try to reduce, especially in the enclosed environment, the amount of noise that is present in the industries. Also, the noise should be controlled. Those that must work in very noisy environment must wear earmuffs. Then the sound of our machines should be reduced. And then those that are working in very loud environment should stay within that environment should be very minimal, so that the exposure will be reduced. Then, of course, we cannot rule out routine checks. When you have problem with your ear, it's not when you go to chemist and they start pouring all manner of things in your ear. Many times, that would actually predispose you to the hearing problem.
Right.
So I think if we do this, we're most likely going to reduce the hearing loss in our environment.
Well, that was going to be my last question, but let me quickly add this. Now, I've seen people who, when they attend parties or are in loud environments, they stuck in either cotton wool or tissue paper in their ears. Is that a good measure to prevent hearing loss or the effect of loud sounds?
Well, that's new to me. I've not seen that before, but I think that to some extent. But the best thing is to wear earmuffs. But of course, when you wear earmuffs, you will not enjoy the sound of the music. So it's like this to reduce the noise. Yeah. That's the thing.
All right.
Let me just add this. You don't know, but we know. We see them every day. The number of patients coming down with hearing loss from slums is on the increase. From domestic violence, from assault, from police brutality, from all that from law enforcement agencies.
Wow.
When you hit somebody on the ear, the chance of the eardrum tearing open is very high, and that will immediately. In fact, I have a case I'm handling. The lawyer from River State went to Abia State to go and defend the case. I don't know where he was looking, and it was slapped by a policeman. He came back the next week, and after the examination, the hearing loss hearing loss has started, and he has gone to court seeking redress. So we the professionals, the media people, we need to talk more about this because it's what we can prevent. If people know that slapping somebody, a man slapping his wife in the ear will make the wife have hearing problems, a boy slapping his girlfriend in the ear, police slapping the public in the ear will cause hearing problems. I think that we should try to hold our hands so that this will not continue.
All right.
I think that's my addition.
All right. Thank you very much, Dr. Ikenga, for your time. I do appreciate it.
Thank you very much.
Have yourself a very lovely afternoon.
Thank you very much.
Well, I've been speaking with E.N.T surgeon, Dr. Victor Ikenga, and as much as you've heard is as much as we've learned. I'll be asking you right now, the phone lines will be open in a minute. Do you think that Nigerians pay enough attention to the health of their ears? Have you seen anyone around you who is particular about their ears or their hearing? And for you as an individual, do you pay attention to how well you hear? And really, how well do you hear? How well do you hear?
Different ideologies,
Different perspectives.
share your views on the sunny side.
92.3 Nigeria Info.
Let's talk.
Let's talk.
0817-923-0002, 0817-923-0003, 0817-923-0007, or 0817-923-0009. That's the female line. You can also join the conversation via WhatsApp. The WhatsApp number is 0809-030-6416. Good afternoon. Good afternoon. All right, you're going to have to call me back. Hello, good afternoon.
Hello.
Good afternoon.
Good afternoon.
Talk to me.
My name is Susie. I'm calling from Oyibo.
Go ahead.
My ear is always itchy. It's always itching me.
Okay.
Then sometimes I will use a cotton board to scratch it. I didn't think the doctor was still around. I would have asked him why my ear always itching.
All right. The WhatsApp number once again is 0809-030-6416. I believe our 084 number is up, so you can call that as well. 084-461-923. We're streaming live on Facebook and Twitter, so you can watch and comment on Facebook at Nigeria Info 92.3 PH and on Twitter at Nigeria Info PH. Good afternoon.
Good afternoon. Yeah, I'm on the I'm calling from Nkoro. I'm supposed to ask a question, but the doctor is not there. But I'm advising people to have somebody on the ear. It's not good. And what the woman said is true. My ear, the left hand side, always crashing nose. And even that cotton board. Sometimes now this will have to cotton board. You might just feel out to inside your ear. It will not come out all this kind of things there. So I don't know the kind of tablet you will take for the infant to stop. But if we use our hand, so our hand not going deep down. When we use it, if it's not good, maybe my hand, the way that they keep here, maybe if you choke it with force, you have force on your ear. I don't know the kind of tablet you will take to stop that increase and that crashing. Thank you very much. God bless.
Thank you very much. Sadly, the doctor is not on the show anymore, but from the things that he said, I'm sure you know how to prevent it and what treatment options are available. Because I asked him that question, and you know, he mentioned certain things that you can do. So what if you have any itching or any ear problem or hearing problem? I think the right thing to do is go to the hospital and get the recommended treatments available. But how well do you hear right now? I'd like to know that. Good afternoon. You're really, really, really faint. Good afternoon. You can send a message on WhatsApp. The WhatsApp number is 0809030616, or tweeting at Nigeria Info PH, on Facebook at Nigeria Info 92.3 PH. How well do you hear? And how do you pay attention to your hearing? Good afternoon. Are you there? Good afternoon.
Yes, this is Chibroma.
Go ahead.
Yes, I thank the doctor for appealing to the policemen to talk to Africa. And also, I would have needed the thing also to appeal to the public, the caller, the radio station, so that people will not say Gabriella is having a ear loss, hearing loss. And Gabriella has died at the end of the when they call, they will not.
Chibroma. It's really, really, really faint. I'm straining to hear you right now. How ironic. Anyway, thank you for calling. I'd have to move on right now. On Facebook, Sonny Kelechi Ihegwazi says, yes, sometimes I strain to hear. On Twitter, it's at Nigeria Info PH, but on WhatsApp, let's take a few messages. Fregabo Cliff says, this side of the world perceives health as a business for the rich, so health facilities are visited only when the situation is a bit critical. That ain't right, you know. But thank you for sharing, Cliff. And this says, okay, I can't give you the doctor's number. If you want to speak to an E.N.T surgeon, you would have to get to the hospital and you would have access to one. Idowu from Bonnie says, please advise people that are using earpiece for long. They should desist from that. 0817-923-0002, 0817-923-0003, 0817-923-0007, or 0817-923-0009. The WhatsApp number is 0809-030-6416. How well do you hear? And how well do you pay attention to your hearing? Good afternoon. Hello. Good afternoon. Go ahead. Okay. Go ahead. Go ahead. Are you there? All right, sadly, you're the last caller I will have to take as the time is up. But remember that your health is paramount to anything. Your health is key. So when you notice that you cannot hear clearly, or you have to strain to hear, or someone has to speak a little bit louder than they normally would just so you hear them, you need to run to the hospital and get your ears checked. And if you nip it in the bud in time, do you think that at any stage in your life, I'm sure that you have had to experience some kind of suffering? I think everybody has. Correct me if I'm wrong. But do you think that, suffering makes you stronger? You tell me. We'll have that conversation right after the news updates at 1 o'clock. So don't go away.